The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Thanks a million for joining us for today's HPM Lunch and Learn webinar on chronic disease management. My name is Donal O'Neill. I'm the marketing manager for Clonwilliam Health. And with me today, as usual, I have Ronan Leonard, who is the support team lead for HPM. So today,
hi everybody.
Hi, Ronan. Today, Ronan is going to run through a demo of the new CDM functionality in HPM. We will run through the demo and then we'll allow a bit of time for questions at the end. So if you do have a question, you'll see on the right hand side of your screen there is a questions panel. If you simply type your question in there, that'll come through to myself and I will do my best to ask Ronan as many questions as I can once he's finished with the demo. As usual, we'll try and keep this in around a half an hour today, but we may be a bit shorter or a bit longer depending on how much we have to get through. So with no further ado, I'm going to pass the controls over to Ronan and he is going to launch into the demonstration. That should be on its way to you now, Ronan.
Yeah, thanks, Donal.
Perfect.
So, thanks a million. Hi, everybody. Sure, look, we'll just jump straight into the webinar. The first thing I just want to make you aware of is let's just go through the version. So if I go to help and about, the version that you're going to be getting is version 3.6.4.4. And also in the help section in latest release notes, there's going to be a section here and it's going to have the latest release notes with links to videos as well. That's going to go through the chronic disease management. So we plan on kicking off the rollout of that either late this week or early next week. We'll be doing it sort of the way we always do, kind of in a phased basis. So it'll be a number of sites per night. We can't sort of do it big bang, just in case there's a lot of calls the next day with queries and stuff like that. So if you're eager to get it, you can certainly give us a call and we can sort of move things around and get it to you sooner if you need to. Okay. So I'm just going to go through a couple of housekeeping things before we actually have a look at it. The first thing to go through is the requirements that are needed in order to use chronic disease management. Firstly, you need to have signed your contract with the HSE. So if you haven't done that already, do that now, as I think the HSE have to turn on something on their side so that you will get something back. Otherwise, I think they will be the visits and reviews will be rejected in the tracker. Secondly, you need to have a HealthLink certificate installed on your machine as it uses HealthLink to submit. So I'll show you where you can check that. It has to be installed in Internet Explorer. So you can just open up Internet Explorer like I have here and just click on this, Tools, Internet Options, Content, and Certificates. And if you have one, it'll be listed here. We'll close that. So also just to go through that as well. So secondly, next in line is there's no need to have a PCRS certificate, which is good news. And there's no PCRS registration either. So it just means it removes that piece from the sort of the registration. So it might actually be a bit quicker. And finally, the patient needs to be 75 or over, as you know, and they also need to be a medical card patient. Next thing to cover is, I'm sure most of you are aware, but the diseases covered in CDM are type 2 diabetes, asthma, COPD, cardiovascular disease, including heart failure, ischemic heart disease, cerebrovascular disease, and atrial fibrillation. Just to note as well, when using CDM, if you've been submitting previously for the selected patients on either the diabetic cycle of care or heart watch, and the patient is over 75 and a medical card patient, you need to transition these to use CDM going forward. You won't be submitting them with the diabetic cycle of care or heart watch. So that's important to know. It'll save you doing it twice, Donald, you know.
Yeah.
So just to go into the actual CDM piece itself, there are 2 actual reviews a year. That can be submitted. Now they're broken into a first or annual review and then an interim review. All reviews have to be at least 4 months apart with a maximum of 2 reviews per calendar year. So without further ado, I'll go into a chart. So we have a 75-year-old here with a GMS number. So you just go in the chart, click on protocols, chronic disease management. And as you can see, you have the whole chronic disease management screen. So on the left here, we have add review. So if we click on add review, the very first screen you get here is the registration screen. And this allows you to register some details of the patients along with selecting which chronic conditions the patient has. Now, these 3 details are populated already for me because I've been adding reviews to this patient already. These won't be, so you just fill in these 3 and away you go. It also brings in any coded conditions that are already in the chart. So I'll just cancel out of this and I'll go back to the chart just for 1 second. If you see in here, I actually have an ICD10 code and an ICPC2 code, one for asthma and one for diabetes, just to demonstrate, Donald, that they actually get brought in automatically.
Sure.
Into the actual review. Now, if there's one missing here that you want to add, you can tick a box here and just put in the registration year here. But it's important to note that this won't record it back into the patient chart as well. You need to make sure when you've done this, you go back into the patient's medical history and add in the condition there afterwards. Okay?
Mm-hmm.
So we'll do this. So we fill in the details here and then we just click OK. And as you can see, the actual review will open up and it'll be in an incomplete state because we haven't added anything in yet. Okay. So there's 6 specific areas on the left that need to be looked at. You can click on each of these options in turn. So you can click on you can go through all of these, or it's actually all on one page, Donald. So while it looks very large, it's all actually just one page that you can use the scroll bar on. But these are very handy because it just brings you to the specific areas. So you'll see a nice feature there as well down the bottom. It actually tells you how many fields are still required. And when you click on this little arrow to the right, you can select the area to actually enter the details. So again, if you've done most of it and it won't submit for whatever reason, or there's still stuff, the submit button is grayed out, this will guide you as to where there's something missing. Okay?
Yeah.
So all the required fields will have this little yellow icon on them, so you know which is required. So what we'll do is we might just start one. We'll just go through one at the moment, and it's bringing in the height and the weight automatically, and the BMI is calculated, the weight circumference and the pulse rate. That's bringing it in because I have patient vital signs already in the chart. You can type that stuff in if it's not there. Okay, so we'll just select a few values here. I'm just going to go through them one by one. So that's the first piece done. We'll go down to risk factors then, and we can tick a box here. The smoking status. Now this is the smoking section. So if I select, there's a few sections here, Donald, that if I select them, you can see stuff appears straight away. Additional questions appear based on what I actually select.
Okay, I get you. Yeah.
So if I select current, if I select ex-smoker, there's nothing. But if I select current, I get a few more questions here. Whether you've referred them anywhere or anything like that. So we'll just tick that box there. We'll do that. The next one is the alcohol risk score. So when you click on that again, you get another pop-up here. We'll select, say, 2 to 4 times a month. How many drinks? We'll select 1 to 2. And how often? We'll select less than monthly. So that's low risk score 3. Click OK. And then the physical activity. Again, it's very similar. Again, if I say 0 and I scroll down, you'll see that if I go 5 to 7, that doesn't pop up. So if I select 0 or 1 to 4, I get additional questions here, so. And then based on this answer, I get another 3. So it really depends, but it's all pretty self-explanatory. It's very straightforward. So depending on your answers, you'll either get no additional questions or additional questions depending on. So if I select yes, they're gone. If I select no, I can tick that box there that I gave advice on the benefits of physical activity, etc. The vaccines. There's the vaccine section, there's influenza and pneumococcal. If the vaccine is entered in the chart already, it will be brought in here automatically. Okay. If it's not entered in the immunization, if it's in the immunization section already, it will be brought in here automatically. If it's not, you can select to add.
Sure.
Okay, and put in the dates. Same with pneumococcal. So I'll just select no. And then the next one is the CVD score. So again, now this is based on your age, ethnicity, and various other labs and stuff like that. Now, labs we're going to touch on in a minute. A lot of these might not be in the chart currently when you're doing the very first portion of this review, and I'll explain that in a minute, but just in my case they are, because I just done a bit of prep. So you can type these manually as well if you want, just to get your overall score. So this is the overall CVD score after I filled in the details here, and just click OK. And as you can see, it gets populated there. So the next thing on then is the investigations. Now this is your bloods. Now, so if you think about it, you need to take bloods on the sort of the first meeting with the patient. So what will happen is you'll probably fill through most of this, and then when you get to the bloods, a lot of these will be blank because they're just not there yet. As the nurse or doctor will need to most likely take bloods during this visit. But if the patient has been to the hospital recently, they might be populated. So with the necessity to do that, really each review in the system could be more like sort of 2 interactions with the surgery.
Mm-hmm.
So there'll be one to fill in all the detail we've just filled in, and then take the bloods and send them off to the lab, and then one a few days later when the labs are back to finish out the review and submit. So what I'm going to do is just at this point, I'm going to just hit save.
Mm-hmm.
And that's saved, and I can actually just close that there in the corner, and then say if the patient comes back a few days later, I go back in to chronic disease management, and I can just pick up where I left off. I can go back down to investigations, and a lot of them would have come in. Now, the way these are mapped is very similar. I'm sure a lot of people are similar with the way the cycle of care works. Because there's so many different labs in the country, and they have exams named in slightly different ways and stuff like that, we actually have to pick certain test IDs that we will use out of the box. And if different test IDs are being used for different tests, they won't be matched automatically. There's just no way to do it because there's so many different types, really.
Mm-hmm.
But what you can do, if something's not appearing here, as you can see, there's a few here that are matched cholesterol. You know, all the other ones are all matched already. They're all bringing in the correct values. But if you find one that's missing, or if you find a few that are missing, you just click on these 3 dots here and just hit search.
Okay.
And you see that that's actually called hemoglobin value. It just in my case, what I did, Donna, was I just added a lot of tests into the patient chart just so that I'd be able to demo them.
Mm-hmm.
It may not be called hemoglobin value. It could be called something slightly different, you know, but this is just in my case. So if you know that this is the correct value,
mm-hmm.
you just hit your search, click OK. And now what you should have gotten a pop-up there. Now it does appear. I don't know why it didn't appear there. It did earlier today. You should get a pop-up saying, would you like to keep this mapping going forward?
Okay.
And what that means is you don't have to do it for every single patient review. Once you've done it once, if the next patient has the same test in their chart, it'll find it automatically. You know, it's not like you'll have to do this at every single review.
Okay, that's great.
You know, so it's the same as the cycle of care in that respect. Just to know as well that the labs have to be from the last 3 months. If they're not done in the last 3 months, they won't be accepted.
Okay.
And also, the labs are they're different depending on the type of review. I think there's a lot more for people with diabetes than if it was just for asthma, so to speak. But there's different requirements there. So that's pretty much all the investigations. Apart from, you see, there's a few there with NA. I just wanted to talk about this. NA doesn't stand for not applicable. It stands for not available.
Okay.
Just to note. So I've left one here that's actually not there. So you have a few options, a few tests here that you can actually mark as not available. So you just click on the button and it's marked as not available then. So we'll just go through these 2. We'll mark these. And there's 5 fields required, so we can find out where. So retinal screening. So this is helpful because we can actually just go back up. As you can see. Patient education. So this is the care plan. So basically you can finish out sort of the review at this point. You can go into the patient education section and then into the care plan also and run through this with the patient, and you can save and print then if you wish. This care plan isn't submitted, but it is recommended you complete the care plan for each patient. And you can also check the medication in here also. So you can do a medication review. Donald, if I click on view here, it'll actually bring me back into the medication and I can see what the actual patient is on.
Okay.
Okay, so we can go education provider, we can go yes. And just say yes.
Yeah.
Okay. So at this point, you can go into the care plan. So this is the final sort of screen of the review, but the care plan is below it. So you can go into the care plan now, fill in all these details here and just print and save it. Or you can actually submit and then do the care plan afterwards, whichever suits yourself, you know.
Okay.
So medication review. And one more field, agree to the care plan. Yes. So that's pretty much everything there. So that's ready to submit now. There's 0 fields required. So now if I save that, and you can see the submit button there, then it comes alive.
Okay.
And then if I just hit submit.
And that will only come alive once everything has been inputted correctly, or everything.
Once everything is inputted correctly, and then you have to save it.
Yeah, no problem.
And now straight away you can see that's been submitted, and the status is brought back up to the top of the page, and the status has changed to awaiting acknowledgement. Okay.
And sorry, Ron, we just have had a question in that I think is probably makes sense to answer it now while we're on this section. Yeah. So, how far back will information be auto-populated into the system, i.e. weight, height? You mentioned bloods at 3 months, but say will smoking status be added automatically if already selected? And sorry.
No, I don't. No, the smoking status I don't think comes from the labs.
Okay.
Because it's actually a radio button, so I don't think it comes from anywhere. I think the only values that come in from the exam section are the ones that have these 3 dots and have the figures, you know.
Okay, and
I can double check that. I'm not 100% sure, but I'm 99% sure it won't. It'll only be the investigation section that it will bring in stuff from the exam section of a patient's chart, you know.
Okay, I get you. And then just one more, will EGFR be calculated by the upgrade?
EGFR calculated?
Yeah, will it?
No, not that I'm aware of. As far as I'm aware, it will just bring back the EGFR that came back from the lab. That's in the exam section.
Okay.
So EGFR is there in the investigation, but there's no calculator that I'm aware of anyway.
I get you. Okay, perfect. Thanks.
Okay. So where were we? So we've submitted there. So I'm going to go back through. I'll go back through that again in a second because I'll be showing the kind of the interim review very quickly. So I just want to go through the tracker first, Donald. So the next thing you'll do after this is you'll go to the claim tracker. So the claim tracker is in tasks, and it's in the same area as the cyclic care tracker. It's called chronic disease claim tracker. Okay. So we click in here, and now I have one. I should have 2 now. If I hit search. There's 2 there that are awaiting acknowledgement. So you can see you can filter by date and you can filter by status and you can click on a search. All right. So you'll also see there's a message area on the very right hand side here. Now there's nothing there for me because I haven't got nothing back because I'm submitting it down onto the HealthLink test site.
Sure.
And I think they might have had issues on the test side this morning. So normally there should be a message ID here, but there isn't in this case, but there will be. I have a screenshot of it here. It'll look kind of like that, claim ID, okay? Mm-hmm. Unsent ones will be here also, so you can actually filter by unsent, and you can open the chart. There's none there for me currently, but you can highlight, you can open the chart, or if you're confident they're filled in, you can actually submit them from here as well. So you could sort of do essentially as well if you wanted, but I would imagine in most cases you'd want to sort of go back into the chart and make sure everything is right. So it'll also as well, rejected ones will be here, and if I'm going to just leave it at awaiting acknowledgement, because if there's a rejected one here, the message here of as to why it was rejected will also appear If you hover over it as well, you'll get more information. If you look again, this one here, like if you hovered over that in real time, it would tell you why it was rejected if it was rejected.
Okay.
All right.
Yeah.
So when you actually submit a CDM review, the first message, there's sort of two messages that go. There's one message with no clinical data that goes to the PCRS. The patient name is anonymized, the GMS number and the GMS doctor number, etc., is sent in order for the PCRS to identify that the actual GMS claim is valid. The second message is with clinical data that's sent to the HSE clinical data repository. Now, at the moment, you will only receive PCRS responses. The HSE will be responding to the clinical messages in due course. We don't have a date for that. That's the ball's in their court at the moment. So just what that means in layman's terms is, at the moment, the most up-to-date status you will get is awaiting acknowledgement. Right? There'll be no accepted, because it's not accepted in the clinical sense until they send the clinical response. But just to make you aware that after the submission, the message will be, they will be in the status of awaiting acknowledgement in the patient chart and in the claim tracker. When you download from HealthLink and the PCRS have sent a response, the CDM review will be updated with the response. It'll be either rejected with a reason for rejection. So if that's the case, you just have to go through here, highlight that and click, like open the chart, update it with whatever problems there were. The GMS number could have been wrong or anything like that. Or it'll be set to awaiting acknowledgement, but there'll be a claim ID. This is the crucial thing. It will still be awaiting acknowledgement, but there'll be a claim ID here.
Okay.
It won't be rejected. As long as you see awaiting acknowledgement and a claim ID, they've accepted the message and you're going to get paid.
Okay.
That's the advisory we've been given.
You only need to take an action if it's this.
If there's a problem with it, it will be rejected.
Okay.
Pretty sharpish.
Yeah.
You know.
No, good to know.
Because I know a lot of people would be looking and go, why are these all awaiting acknowledgement? It's because we're waiting on something from the HSE side for the actual clinical portion of the message.
Okay.
All right.
Yeah.
And so once that's all done, you'll just need to wait on the HSE to respond to the clinical message in order for the review to be updated to accept it. And as I said before, if the HSE reject the CDM review, then you'll need to see the reason for the rejected review in the tracker or the patient's chart, and you can update the claim and resubmit.
Okay.
Okay, so that's pretty much that. Really, you know, what I can do is I can go back into the chart. So that's going to be the sort of the first visit or the annual visit. But so you're going to be doing an interim visit, which is at least 4 months afterwards. So what I can do is I can click on here, and I'll just click on add review again. Now what I'll do is it won't actually let me add another visit, obviously, because I've just done one today. So I'm going to just forward date this to 7th. Now, don't do this, obviously, because you won't get paid for it if you do it now. But this is just for testing purposes. So just forward date. This screen will always appear at the start because obviously a patient could have developed new conditions since the last review. So the registration screen will always open up and you can tick a box. But like I said earlier, if you tick something new here, make sure to add it back in the medical history section in the patient's chart. So if I click OK on this, you'll see now, if I go back up to the top, you'll see now that this is called an interim review and it's incomplete. So you see diabetes type 2 interim review and asthma interim review. And basically it's pretty much the same. It's you just go down through all your details and just submit again. Now you can see there's a lot less fields required this time around just because of the stuff I've entered previously. It's actually seeing the labs from today again, even though, like I say, it's not like for like because I've kind of manipulated the system to think it's 4 months when it's actually not. It's just to show you that it's pretty similar. The interim review is pretty similar to the annual one.
Okay.
So I'm just let me just go through the documents to make sure so I have everything covered. Medical history, yeah. Show the buttons. I'm ready for questions now, Donald. Actually, if
Okay.
there's a few coming in.
That's a good time. We've just had a couple in there. First off, how do you get back into the CDM review screen?
Yeah, so I'll close here. So it's in protocols. and chronic disease management.
Okay, excellent. And that pops you straight back into it. I see.
And then your visits will be here. And if there's no visits, you just, or your reviews rather will be here. And if there's none, you just click on add review.
Great. Okay, excellent.
And you close it over here. This X over here closes it.
Very good, very good. And do you need to have the patient's air code? Just, you know, a lot of times people wouldn't know their air code or wouldn't have it. So.
Yeah, I was messing about with that myself the other day because I wasn't sure. But what we'll do is I actually don't think you do.
Yeah.
So I actually don't think you do. So what I'll do is I'll just delete this one here, and I'll add another one. Now, I think this might be. Oh, it's because I haven't updated the date. 1 sec.
There's always something, isn't there?
Yeah, now, so let's just see. Yeah, no, that's fine. Air code's not needed.
Okay.
Because I was thinking that the other day, actually, I was looking at it, I was like, I know they thought everyone would use it, but not everyone actually does, you know. So.
Okay, excellent. And then when you go to the meds from the review, how do you get back to the CDM review screen?
So I'll show you that now. That's a good question. So if I go to the care plan and our patient education, so medication. So we click on the view button and we're in the medications. See this here? Just click this red X.
Ah, brilliant. Okay, so the red.
Bring it straight back. But if the worst comes to the worst and everything gets closed, you just go protocols, chronic disease management, and it'll bring you straight back.
Okay, excellent. And you might not be able to answer this one, but I'm going to ask it anyway. Will both coding systems, i.e. ICD10 and ICPC2, will they be recognized and captured by CDM?
Yes.
Yes. Okay, great.
So my understanding is that there was a guideline given to use ICD10 coding, but no absolute requirement for just ICD10 coding. So if you look here, I've actually have two here. So I have asthma. I'm nearly sure if I search for this is actually. So if I go ICD10 and search for asthma, you see there, I've added the ICD10 code for asthma, J45. And for diabetes, I've actually added the ICPC2 code on purpose because I wanted to see myself.
Okay.
And so if I go back in here again, you'll see from the start the registration screen I showed you, it picked up the two of them straight off the bat. But like I say, just to be aware that if you're adding a chronic disease management review and you don't have a condition coded here and you tick the box on the registration, make sure you go back here and add it here as well. It will not add it from that section. Do you know what I mean? So it's just to make sure you do that.
Okay.
But if they're coded here with either ICD10 or ICPC2, it'll pick it up.
Okay. Excellent. And next question: does any value, for example, BMI, etc., that is hand typed into the CDM screen, is that auto-populated back into the vital signs of the patient's chart, or do you need to complete these values in the vital signs before opening the CDM review?
Well, I know the first few, the height, weight, and BMI and stuff, I know I can type them in manually in CDM. I don't think they populate back in the exam section as a result of that. Okay. I know for a fact that for investigations, you cannot hand type anything.
Okay.
It has to be in the exam section. So my advice would be, just from a clinical perspective, add the vital signs in as an exam first, because number one, it's in the correct spot, then it's in your exam section, it's there for everyone to look at regardless of CDM. And number two, when you go to do CDM, you don't have to type anything.
Okay, excellent.
You know? So that would be my advice.
Okay, excellent. And this one is on about codes. Diabetes is coded as incident diabetic and non-incident on HPM instead of type 1 and type 2. Will that be changed, or can that be changed?
I don't think so. I see we don't own these codes.
Yeah.
you know, it's, my understanding is this is just you know, the WHO. I think, I'm not sure, but we wouldn't be changing the name. Like, I'm not sure which one is insulin dependent and which one is not, but it's just the naming convention that they have used, you know.
Sure, and we
Um,
follow their conventions, so that would be
mhm.
one for the HSE, really, would it?
Yeah, but I mean, I don't imagine there would be an issue with the HSE. You know, you know, you'd be using the right type of diabetes to. It's diabetes type 2 is the condition. So whichever diabetes type 2 is, whether it be, I think it's insulin dependent, but I'm not 100% sure. Whichever one it is the one you use. You know.
Okay, okay, grand. I'm sorry, just going back to the previous question, just to clarify things. If they do have, say, blood pressure, weight, height, and smoking status in the exam section in HPM, will that be auto-populated into the CDM?
Yeah, I can
Yeah.
confirm that the likes of this will be,
Yeah.
but the smoking, I don't think so, because
Okay.
the smoking is a radio button that you have to select, and there's follow-on questions then as well. Do you know
Yeah.
what I mean?
Yeah.
If you select yes or no, so I think that needs manual input.
Yeah.
But I can tell you right now that in this person's test chart, I added vital signs manually an hour ago and put in these values, and when I went to add the CDM review, they were there.
Okay.
But if they're not there, you can match them in the same way you can match them in the investigation section. But the difference is, in the investigation section, you can't hand type values. You have to match them from something in the exam section. And that's by design, so that the actual labs, the bloods, are recorded in the exam section, not just hand typed in the CDM review.
Okay. Okay. Excellent. And then just a request to see the care plan screen. You might just show the care plan
Yeah,
if you can,
sure,
and
yeah.
run through.
So if I go in here, so this is the care plan screen. So you have the name of the carer and the family member, consent to disclose care plan, medical conditions, medications. You can refresh. So it's bringing in the medications from the screen. You can print them there as well if you want. Have you any concerns regarding your medications? So you can sort of go through everything bit by bit, select yes or no, type in whatever you want to type in. Use your scroll wheel to go down, health and well-being, any concerns. And then it brings in sort of the advice and the alcohol, weight interventions, anything that was done in the other part of the review, it'll bring in here.
Okay.
It brings in your influenza vaccines as well, and kind of your overall goals agreed at last review. And as you can see, there's nothing there because this is the first one, you know. Overall goals reviewed, agreed at this review. Fill in the rest of your details, and first thing to do, as always, important, save, and then if you want to afterwards, then you can print it.
Okay. Okay.
But there's no submit button here because this doesn't go to the HSC. This is just for the patient, but we do recommend doing it.
Excellent. Excellent. Excellent.
Okay.
Okay, I think that covers pretty much everything. And look, this webinar will be added to YouTube later on today, so please feel free to kind of review it and go back through it. Or if you have any questions, we're here to help, and Ronan and the guys are on hand to help as well. So look, hopefully everybody found this informative and educational and beneficial. I'd like to thank Ronan for his time. That was a really comprehensive overview of everything to do with CDM, and hopefully everybody benefited from today. So thanks a million, Ronan, and thanks everyone for tuning in.
Just one other thing as well, Donald, just on the actual investigations and the lab matching in the CDM review, there's going to be another video that's going to go up, that's going to just be for that. You know, just because I know it's complex enough. It's been done before in the cycle of care, but there's going to be a separate video that's going to be up on YouTube just for that as well. I think it's about 3 minutes long. But it's just if you needed guidance when the time comes, there's a video going to be there as well.
Excellent, excellent. And look, what we'll do is we will send out another email after this with a link to the webinar, but then probably next week at some stage with a link to that video that Ron is mentioning there, and just to our other our FAQs and our quick guides around it as well. So hopefully you should have all the information you need to sort of start using the
Yeah, and as well as that, just if anyone has any questions at all, feel free to give us a call. There's a lot in this, and there might be stuff that I might have covered a bit too quickly or something like that. So any questions, give us a call.
That's great. Okay, listen, thanks a million, Ronan, and thanks again to everyone for joining us today. Yeah, look, thanks. Cheers.
Thanks, Donald. Bye bye.
Bye. Bye.